Hi guys, this is Mr. Pharma. Usually I don't take any serious subjects in related to pharma, but today indirectly I wanted to give awareness to the public on the engagements about radiation sickness drugs. You may ask why now? Why is it important to know about radiation drugs? The current rising situation globally related to the conflicts between Russia and Ukraine has created a global threat. As there are threats about nuclear warfare, I wanted to give you the awareness about the medicines that are used in the time of nuclear radiation. US government in the last week bought around $290 million supplies of a drug designed to treat blood cell injuries following radiological and nuclear emergencies, and some European countries have already started purchasing, stocking and distributing radiation treatment drugs such as potassium iodide tablets. So today let us see some important medications that is being used in nuclear radiation treatments. Welcome guys, this is Pharma Portal, the pharma you need to know, share and grow. Before seeing the drugs used for the treatment of nuclear radiation, let us see what is a radiation. The Center of Disease Control and Prevention defines radiation as the energy that comes from a source and travels through space or other medium at the speed of light. Examples of radiations are light, sound, heat, and X-rays. Radiation is majorly categorized as ionizing radiation, non-ionizing radiation, and cosmic radiation. Several fields use ionizing radiation, including medicine, nuclear power, research, and industrial manufacturing. However, excessive exposure can be dangerous. Radiation exposure can cause cell damage in living tissue and organ damage. High doses can cause radiation burns and radiation sickness, and low doses can cause cancer over a long period of time. What is a nuclear radiation? It is natural for an unstable nucleus to transform into a different type of a nucleus. When it does, it emits gamma rays or small particles of radiation called the nuclear radiation. What is a radiation sickness or acute radiation syndrome? Acute radiation syndrome is also called as radiation sickness or radiation poisoning, in which a concentrated amount of ionizing radiation causes a number of health effects. After exposure to nuclear radiation, symptoms like nausea, vomiting, and loss of appetite may occur within an hour, and severe bone marrow disorders takes place in the next sequence of events. The initial symptoms may improve for hours or weeks, but then develop additional symptoms after which either recovery or death may occur. Are there any anti-radiation drugs? In reality, there are no such pills that stop radiation, and anti-radiation pills are quite misleading, and only very less number of treatments are available as these situations are quite rare. It is important to note that only a few treatments and countermeasures are available that has been proven to be effective. Remember, as of now, there are no drugs or antidote for radiation exposure, but only a limited medical treatments are available for controlling or expelling the internal contamination depending on the type of radioactive material used, such as cesium or radioactive iodine. Let us now see the important treatment and medicines used for radiation emergencies. Drugs that are used for treatment of internal contamination. First, potassium iodide tablets and oral solution. Second, Prussian Blue capsules. Third, pentate calcium trisodium and pentate zinc trisodium injection. The second category is the drugs that are used for treatment of damaged bone marrow. One, Romiplostim injection. Second, Filgrastim injection. Third, Filgrastim injection. Four, Filgrastim injection. Now let's see the commonly used drug potassium iodide. Potassium iodide is used generally in people with breathing problems and used during a nuclear radiation emergency to block the radioactive iodine from entering into your thyroid gland. So how does it work? Potassium iodide floods the thyroid with non-radioactive iodine and prevents the uptake of radioactive molecules which are subsequently excreted in the urine. The dosage forms of potassium iodide are oral liquid 325 mg per 5 ml, oral solution 1 gram per ml, and oral tablet which is available in 130 mg and 65 mg. The usual adult dose for radiation emergency is 130 mg orally and should be taken as directed by the public officials. Things you need to know before you take potassium iodide. Potassium iodide should not be taken as a preventative medicine before radiation exposure, only when emergency management officials tell to take. Potassium iodide protects for approximately 24 hours. It should be dosed daily until the risks no longer exist. Side effects of potassium iodide are skin rash, iodism, and allergy reactions like swelling and joint pains, etc. Potassium iodide is used in children only during a nuclear radiation emergency, and during pregnancy, potassium iodide can cause thyroid problems in both mother and baby. Do not give and take potassium iodide without medical advice. The next drug that we are going to see for the treatment of internal contamination is Prussian Blue. Prussian Blue is used to treat people who have been contaminated with radioactive cesium or thallium or non-radioactive thallium. So how does Prussian Blue work? Prussian Blue works by ion exchange mechanism, that is by trapping thallium and cesium in the intestine so that they can be passed out of the body in the stool rather than reabsorbed. The dosage forms of Prussian Blue are in oral capsules 500 mg. The usual adult dose is 3 grams orally 3 times a day, and pediatrics in the age range between 2 to 12 years have to have 1 gram orally 3 times a day, and as advised by the doctors. The next drug that we are going to see is Calcium-DTPA and Zinc-DTPA. Calcium and Zinc-DTPA is used to treat people who have been contaminated with radioactive elements such as plutonium, americium, and curium. So this substance binds with the radioactive elements and are excreted in urine. The dosage forms are available in injection solution concentrate, and the usual adult dose is 1 gram once a day via IV, and pediatrics who are ranging between 2 to 12 years should have around 14 milligram per kg once a day and should not exceed 1 gram per day. Now let us see the drug that is used for the treatment of damaged bone marrow during a nuclear radiation, Romiplostim injection. Romiplostim is used to treat people including newborns who have been exposed to high level of radiation and to prevent bleeding episodes in people with chronic immune thrombocytopenic purpura, a bleeding condition that is caused by a lack of platelets in the blood. So how does romiplostim work? Romiplostim are platelet stimulating agents called TPO, thrombopoietin peptide mimetics, that works by mimicking the action of your own natural TPO to increase the platelet production. The dosage forms that are available for romiplostim are subcutaneous injection in strengths 250 microgram, 500 microgram, and 125 microgram. The adult dose starts with 1 microgram per kg until a specific platelet count is achieved. The things that you need to know about romiplostim injections are very important. Based on the animal data, romiplostim may cause fetal harm. The data is unavailable precisely because the use was only studied in animals because it could not be studied in people. The warnings for this drug is severe, hence you have to consult a doctor before getting administered. Similar to the romiplostim drug, there are drugs Filgrastim and Filgrastim which stimulate the growth of white blood cells in your body. These two drugs are also being used for the treatment of damaged bone marrow during a nuclear radiation. Hope you liked this video. Encourage us by hitting the like button. If you have any question, post it in the comments and share this video to your friends and family. Most importantly, subscribe and press the bell icon for regular notifications from our Pharma portal channel. Bye.